Thank you. Thank you for the opportunity to speak to you. So much of my work involves using qualitative methods to develop effective health interventions. Now, qualitative research encompasses a variety of theoretical positions and strategies, but fundamentally it's concerned with understanding the meaning that phenomenon has for people. So why is that relevant here? Well, because individuals' interpretations of their health and health behaviour is key to understanding how they interact with interventions and trials. So what can qualitative research do for RCTs? Well, firstly, it can enhance the relevance of an intervention. Oh, there we are. Okay, so for example, we used an iterative qualitative design to adapt acceptance commitment therapy for older adults with generalised anxiety disorder. Now, this is a population characterised by comorbidity and high healthcare utilisation, whose symptoms can persist for decades. So to meet these complex needs, we put those that would use and deliver the intervention at the heart of saying what they wanted from it and what would work in practice. And we're now using this person-based approach with colleagues at UCL to optimise interventions for other difficult to treat conditions such as depression and dementia, depression and motor neuron disease. But the potential value to qualitative research is broader to this, to trials is broader than this, and it includes optimising trial procedures, so maximising recruitment and retention, helping to ensure that taking part in a trial is a positive experience, and helping with the interpretation of trial outcome data and facilitating its implementation into the real world. So qualitative research can help to understand how an intervention has been delivered within a trial, but also how that might transfer to everyday practice. So, for example, WELD was a 5-year research programme that found that staff training in person-centred care helped to reduce medication and improve quality of life among people with dementia living in nursing homes. Now, while WELD included focus group discussions with staff at different stages in the research process, and they helped us to understand how pressures and interpersonal relationships within the nursing homes contributed to variations in effectiveness. And from there, we were able to build a picture of how training could produce change in different settings. And this clip shows one of those mechanisms of change.
I think it was the person-centred care training day. She said, if you only touch one person for 10 seconds on your shift, you've made a difference to their lives and you should go home happy. Even if you've had a really awful day, if you just make one person feel better, that's what you need to take. And it still makes me want to cry even there. I'm like, it's soppy. That is, I cling to that every day sometimes. That was the most important thing to me.
So the qualitative data generated 6 publications. It informed a series of workshops that promoted the sustained use of the WELD intervention. And WELD was selected as a case example at a Making the Case for Social Sciences event at the House of Commons, really underlying the impact that qualitative research can have. Now, traditional interviews are useful, but other innovative methods can help to get even closer to the lives of service users. These include things like dyadic interviews, so bringing together pairs of participants to discuss their joint experiences of a health intervention. They include collaborative research practices, so for example the work of Claire Laboutier, who's seeking to bring together people with cancer and healthcare professionals to co-produce a model of care for living with and beyond cancer. And they include things like audio diaries and visual diaries that can provide access to people's thoughts about an intervention in real time, rather than relying on retrospection. So, for example, the work of Kate McCombie, who will be developing a qualitative diary app to capture the experiences of people with eating disorders, the treatment experiences and recovery. But innovative methods are insufficient in themselves to bring service users' experiences centre stage. This remains an aspiration rather than a reality. To maximise the value of qualitative research for trials, its purpose must be explicitly stated at the outset, but also it must be embedded at design phase with ample consideration given to how the qualitative data will be integrated with the outcome data and economic evaluation and the patient public involvement and so on. So just to conclude, it's been really exciting to see our team grow, and we're now providing advice on qualitative research for an advisory service for King's Clinical Trials Unit. And the last thing I'll say is that I believe value lies in prioritising the perspectives of service users, and this is essential for developing effective health interventions that are fit for purpose. Okay, thank you.